Hello, my name is Shira, and I'd like to thank you all for coming today to listen, and to you and our hosts for coming together despite our physical separation. We have a moment of unprecedented access to learn about behavioral health care and connect professionally and inspire a conversation. And so it's not the least bit ironic that we'll be talking about how we can use digital tools to bring people together and offer access to care, also in an unprecedented way. For myself, I've never worked in a field more personally relevant than behavioral health. I now passionately manage a behavioral health team and product line, but ironically, like most Americans, I spent most of my life without the awareness or vocabulary or effective support for my own challenges. Despite many, many years of managing severe physical chronic pain, it was only after I began to work in this field that I truly understood its relevance to all of our lives and all the medical conditions we face. A woman recently shared with me how she struggled for many years wondering why she couldn't cope with normal life like a normal person. And when a mental health clinician finally told her she had a real mental health condition and there were processes she could use to feel better that were already proven, it was liberating. It changed her identity and it changed her worldview. My own challenges, I believed, were physical and not at all mental. Through years of often debilitating chronic pain, I visited doctors and other professionals in the US and abroad looking for help. If you look back at your own life, at any moments when you cried after leaving a doctor's office, probably you will understand that these were some of my lowest. Helplessness and pain do not mix well with fatigue and lonely fear. A few doctors asked if I was stressed, but that's as far as they got into my mental health, and not many even asked that question. When have you ever gone to a doctor for a broken bone or stomach pain and had them actually assess your anxiety and depression levels? It's just not really a thing, and most of us wouldn't even know to ask for it. But this makes it so care for our mental health is very rarely accessed and much less effective than it could be. And care for other medical conditions are also less effective. If you're listening today, if you're attending this conference, perhaps you already know that most Americans who need help don't know to seek it. Most lack the vocabulary to ask. And those that do know to seek care find their depression or their anxiety exacerbated just trying to navigate the system, looking for quality, trying to find coverage, looking for ease of access, and trying to avoid stigma. And mental health care lives on its own in a faraway silo, as though it isn't tied up so much in all of physical health care. We know that there's an enormous gap in care. We know that even before this pandemic, almost half of adults in the US would be diagnosed with a mental health condition at some point in their lifetime, and that more than half of those would never receive care. We know also that behavioral health conditions co-occur with obesity and many other chronic conditions. This is at huge rates and has effects on both the other chronic conditions and behavioral health care. We also know that there's a rising impact not only on quality of life, but also on cost. Depression has become the leading cause of disability in the US. And someone with depression costs $2,000 more per year in direct medical costs and over $1,000 in lost productivity and missed work days. And that number increases the more chronic conditions an individual has. We already know that chronic conditions, whether that's diabetes, hypertension, prediabetes, or different types of musculoskeletal challenges, we know that they require daily healthy habits to control them. These are things like activity, physical therapy, eating, sleeping, managing stress and tension. We know it's difficult or impossible to learn and then adhere to these healthy habits, much less to adhere to medications and self-monitoring if you're suffering from anxiety or depression. And now some researchers are finding physiological links at the cellular level between conditions, hinting, for example, that even if you overcome depression to carefully manage your diabetes, you may actually never have it under control if you don't also treat your depression. I find this cellular link fascinating. Now, digital care gives us an unprecedented ability to change all of this, accelerated now by a pandemic that keeps us all at home and as far away from medical buildings as possible. Along with today's pandemic of virus, there's a pandemic of isolation, anxiety, and grief. You can see some of the statistics associated with this from one of my favorite data sources, the crisis text line. You can see the spikes in anxiety, the increase in domestic violence, sexual abuse, and substance use at home, and waves of job loss, grief, and now, of course, racism. Individuals and payers are becoming increasingly aware of the problem. Blue Cross of Massachusetts, in an article quoted on the left, says that half of their spike in telehealth visits has been for virtual behavioral health care. It's added hundreds of providers to its digital behavioral health network since early March, and we see this trend further evidenced in some of United's acquisitions, Cigna's partnerships, and other actions by major health insurance companies. Awareness is rising, which is good, and demand is rising as well. And we know that health plans look to serve their members, but they also look for cost effectiveness. With COVID-19, almost overnight, those individuals who are still accessing healthcare at all began to use digital and telecare as their primary points of entry, because suddenly visiting a clinic in person became dangerous for the patient and for the doctor, especially if the patient has a chronic condition. At Omada, we've been looking at this question for a long time, and now we look at it with even more focus during this pandemic, and even more focus for what comes afterward. What if digital care was always the first point of care? We ask, what if instead of going to your doctor, your first point of care was your phone, and if everything you needed was available at your fingertips? In the midst of this pandemic, it becomes much easier for everyone, not just those of us who innovate specifically in digital healthcare, but for everyone, to envision how such a system might work. We can take a person, for example, who's isolated, overwhelmed, and now chronically panicking. How much easier would it be to reach into their pocket, grab their phone, text a question to their trusted personal healthcare provider, and then within minutes receive support, guidance, and techniques, without having to schedule an appointment, take time out of their schedule a few days later to drive over to the therapist's office and hope that the help is timely and still relevant? It's intuitive that having care in your pocket would be helpful, but there's also a proven concrete need. As we look at national practice guidelines for various chronic conditions and calculate the time it takes to follow them, we realize that doctors would require more time for just 10 of these chronic conditions than the time they spend today with all of their patients combined. There's a rising prevalence of chronic conditions and strong existing demands on doctors. And if these both continue, we will need tens of thousands more doctors in the next 5 years. The rising prevalence of behavioral health needs has only escalated with this pandemic. Within the pandemic, patients have been forced to find alternatives, and they have. Fortunately, the system has moved rather quickly to meet their needs. But it hasn't really filled the gap. Since the beginning of March, we see that in-person visits have dropped dramatically as people began sheltering in place. Virtual care did rise, but the total number of visits dropped by 30 to 40%. What happened to all those people that needed care? Where have they gone? Unfortunately, many people seem to have stopped seeking care at a time when they are most vulnerable. Telemedicine and remote monitoring have been valuable and have provided help during this time of need. They're very important for treating all of these types of chronic conditions, and they are necessary. They are not sufficient. They're not filling the gap. What's needed instead is a system of care and support that is more than just these tools. With digital care, we don't just replace a couple of actions of in-person care, call somebody by video, and look at a little bit of their data. We actually have the opportunity to redesign the healthcare experience for effectiveness, adherence, and access. The patient is at the center, as they always should have been. We can look at their behaviors, their goals, and their social determinants of health. We can provide connected devices, personalized skill paths, goal setting, dynamic lessons, and important data and tracking. We can leverage machine learning and artificial intelligence to surface patterns and insights to them and to their providers. And we can scale it rapidly to every geography, no matter how rural or no matter how much civil unrest. In our program, every single participant has a dedicated coach who proactively builds a relationship with them over weeks and months and years and reaches out to help them and engage them. Our coaches work with specialists in a care team to engage participants, help them navigate and adhere, and support them with expertise in each condition. With the right design, we no longer have separate buildings, separate providers, and separate tools for each condition. Rather, we coordinate together to support one patient, Yes, I run a behavioral health program within Omada, but the goal of that program is to work seamlessly to help both our buyers and our participants to be treated as one person for the most effective and easy to access healthcare possible. Our focus can become a whole person approach that breaks down access to barriers and silos. So Omada is a healthcare provider with a digital care clinic that takes proven clinical interventions in each of these areas: prevention, diabetes, hypertension, anxiety and depression, and musculoskeletal, and ties them all together as can only be achieved with digital innovation. My team had just launched our behavioral health solution a handful of months before the pandemic began. Ironically, the vast majority of our participants happened to be healthcare workers at the time, and they were hit extremely hard when COVID-19 began. So instead of the slow, controlled launch that we'd intended, we decided within a couple of weeks to increase our reach over 100-fold in order to do something meaningful for so many individuals and so many employers who were suddenly in urgent need. Omada usually works with health plans and employers, and we knew our partners and their peers were facing extreme challenges. They already struggled with access to behavioral health care. And now, in addition, the coronavirus outbreak triggered mass layoffs and furloughs. In 10 weeks, 40 million Americans filed for unemployment insurance, and the US unemployment rate spiked to almost 15% in April, the highest level since the Great Depression. It's still expected to reach at least 20%. Certain communities were hit disproportionately, undoubtedly helping to trigger recent civil unrest. We serve employers of frontline healthcare workers and clinicians, casinos, airlines, hotels, cruise ships, and many others who are very concretely impacted the day that the pandemic appeared in the United States. Our partners and the individuals we work together to serve, they needed a new level of support. As we looked at our core competencies, digital access and behavioral health stood out as opportunities to make a difference. We decided to move very quickly to make programming more rapidly available. We decided to invite any employer or plan, whether an existing partner or not, to open our program to all of their employees or members at no cost. It was very difficult to predict the response. I've certainly never lived through a pandemic. I hope to not live through another one. And I hadn't lived through a recession tied to a pandemic. I've never offered a program like this or in this situation before, and of course neither had my teammates. But new challenges call for new risks, and it was exciting and heartwarming to witness how our leaders and our teams came together to take action decisively and with a focus on impact and helping with care. Within days of our outreach, responses began flooding in, confirming that this was a relevant and urgent need, and opening the gateway to thousands and thousands of applicants to be able to come into our program so that we could help them with their needs. I'm talking to you today, right now, from Minneapolis. It's not yet curfew time. 2 blocks away is a pharmacy that was looted every night for 4 nights. Down the street are rows of small businesses that were suffering already through shelter-in-place laws, and then were hit with vandalism and smashed windows. A bit further away, a gas station was burned to the ground. Helicopters circle overhead, filling the air with the rapid heartbeat of propeller blades. My neighbors organized rotating night watch. Someone had an overdose across the street. 911 got overwhelmed and stopped answering phone calls. We used to talk about coming together in our physical isolation during the pandemic, about how the pandemic made it worse, everyone's challenges with stress, anxiety, and depression. Now it's even more true. It can often be hard for me, hard for my team, to focus and be productive in the midst of isolation, pandemic, and civil unrest. But the ability to serve such a poignant need keeps us focused, motivated, and energized. Some participants have come to us with emotional and detailed stories of escalating chronic need. They're in difficult situations, and either they've never accessed mental health care before, or the access they had has been curtailed or cut short. Others arrive, certainly never having experienced mental health care before, telling us that they don't know what they want or how to ask for help, just that they feel bad all the time, and that this program was put before them and it seemed like the right time to take action. We are in a moment of revolution in healthcare. Patients are trying new things, providers are trying new things. My own therapist is trying telehealth for the first time. Regulations are shifting, health plans are adopting new strategies faster than ever before. COVID-19 has brought new challenges, but it has opened our eyes and our doorways to rapid change, and I'm excited to see all of us taking advantage of it. Whether you represent a health plan, a provider, or health system, a regulator, a patient, well, we all really represent patients. This is our moment to step forward and embrace innovation in care delivery, and to quickly see its impact during this time of national emergency. If you haven't already, I'd like to take this moment and this podium to ask you to do something. It doesn't matter which path you choose. Challenge an old rule, support digital care delivery in your own system, or just sign up yourself so that you're familiar with it and fluent and can speak about its value. And with that, I will thank you for your attention and your time, and we will turn to questions.